Did you know that heart disease is one of the leading causes of death in the world? According to the World Health Organization, cardiovascular diseases account for 19 million deaths each year, which represents 31% of all deaths globally. This number is expected to rise to 23.6 million by 2030. In today's video, we will discuss what heart disease is, the different types of heart disease, the causes and symptoms of heart disease, and most importantly, how to prevent it. So, if you're ready to take control of your health and reduce your risk of developing heart disease, then let's get started. Before we dive into the topic, please take the time to subscribe to the channel. We always appreciate your support. What is heart disease? Heart disease is a general term used to describe any condition that affects the heart. It is important to note that heart disease isn't just one condition, but rather an umbrella term that encompasses various different conditions. Some of the most common types of heart disease include coronary artery disease, also known as CAD, congestive heart failure, also known as CHF, arrhythmias, and stroke. The primary cause of most heart diseases is coronary artery disease, which occurs when the arteries that supply blood to the heart become narrow or blocked. This blockage prevents sufficient blood flow to the heart muscle, which can lead to chest pain or angina, shortness of breath, and other concerning symptoms. If the blockage is severe, it can cause a heart attack, which occurs when the heart muscle doesn't receive enough blood flow and begins to die. Causes of heart disease: several factors can increase your risk of developing heart disease. These factors are often referred to as risk factors. Some of the most common risk factors for heart disease include high blood pressure, high cholesterol levels, diabetes, smoking, obesity, physical inactivity, and a diet high in saturated and trans fats. It's important to note that not everyone with these risk factors will develop heart disease, but they can certainly increase your risk. For example, if you have high blood pressure, your heart has to work harder than normal to pump blood throughout your body. Over time, this added strain can weaken your heart and make it more susceptible to disease. Similarly, high cholesterol levels can cause plaque to build up in your arteries, which can lead to heart disease. There are also certain conditions that can increase your risk of heart disease, such as chronic kidney disease, liver disease, and sleep apnea. In addition to these medical conditions, your lifestyle can also increase your risk of developing heart disease. For example, if you smoke, your risk of developing heart disease is significantly increased. This is because smoking damages your blood vessels and makes it more likely that plaque will build up in your arteries. Symptoms of heart disease: the symptoms of heart disease can vary depending on the type and severity of the condition. However, some of the most common symptoms include chest pain, shortness of breath, fatigue, irregular heartbeat, swelling in the legs, ankles, or abdomen, and changes in blood pressure. One of the most well-known symptoms of heart disease is chest pain, also known as angina. Chest pain typically feels like a pressure or tightness in the chest and may radiate to the left shoulder or arm. It's important to note that not everyone with heart disease experiences chest pain, and chest pain doesn't necessarily mean you have heart disease. However, if you experience any type of chest pain, it's essential to seek medical attention promptly. Another common symptom of heart disease is shortness of breath. This can occur when the heart isn't pumping efficiently, causing fluid to build up in the lungs and making it difficult to breathe. Fatigue is another symptom that can be associated with heart disease. When the heart isn't functioning properly, the body may not receive enough oxygen-rich blood, leading to feelings of tiredness or weakness. In addition to these physical symptoms, there are also some warning signs that indicate an increased risk of heart disease. These warning signs include a family history of heart disease, age, and certain lifestyle factors. If you have a family history of heart disease, it's essential to be aware of your risk and take steps to reduce it. Age is also an important consideration as the risk of heart disease increases with age. Men over the age of 45 and women over the age of 55 have an increased risk of developing heart disease. Lifestyle factors such as smoking, obesity, and physical inactivity can also contribute to the development of heart disease. How to prevent heart disease? Fortunately, there are several things you can do to reduce your risk of developing heart disease. Let's talk about them. 1. Eat a heart-healthy diet. Eating a balanced diet that's low in saturated and trans fats, cholesterol, and sodium while being rich in fruits, vegetables, whole grains, and lean protein sources can help maintain healthy blood pressure and cholesterol levels. By reducing your intake of saturated and trans fats, you'll reduce the amount of plaque that can build up in your arteries. A diet high in fiber, such as that found in fruits, vegetables, and whole grains, can help lower your cholesterol levels. Additionally, limiting your salt intake can help keep your blood pressure under control. 2. Engage in regular physical activity. Regular exercise can help maintain a healthy weight, reduce stress, and improve overall cardiovascular health. Aim for at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week. 3. Quit smoking and avoid secondhand smoke. Smoking damages blood vessels and increases the risk of plaque buildup in arteries. If you currently smoke, it's important to quit. If you don't smoke, avoid secondhand smoke as it can still increase your risk of developing heart disease. 4. Manage your blood pressure and cholesterol levels. If you have high blood pressure or cholesterol levels, it's crucial to manage these conditions effectively. This may involve taking medication as prescribed by your doctor or making dietary changes to reduce your cholesterol levels. By keeping your blood pressure and cholesterol levels within the recommended ranges, you can significantly reduce your risk of developing heart disease. 5. Get regular checkups and screenings. It's important to see your doctor regularly for checkups and screenings, especially if you have risk factors for heart disease. During these visits, your doctor will measure your blood pressure, check your cholesterol levels, and assess your overall health. Based on your individual risk factors, your doctor may also recommend additional screenings, such as an electrocardiogram, also known as an ECG, or a stress test. 6. Limit alcohol consumption. Excessive alcohol consumption can raise blood pressure and contribute to the development of heart disease. If you choose to drink alcohol, do so in moderation, meaning up to 1 drink per day for women and up to 2 drinks per day for men. 7. Maintain a healthy weight. Obesity is a significant risk factor for heart disease, as excess weight can strain the heart and lead to high blood pressure and high cholesterol levels. To achieve a healthy weight, you need to consume a balanced diet and engage in regular physical activity. 8. Get enough sleep. Sleep deprivation can increase stress hormones, leading to high blood pressure and other risk factors for heart disease. Most adults require 7 to 8 hours of sleep per night. Getting enough sleep can help keep your blood pressure and stress levels under control, reducing your risk of developing heart disease. 9. Manage stress effectively. Chronic stress can contribute to high blood pressure and other risk factors for heart disease. Find healthy ways to manage stress, such as practicing deep breathing exercises, yoga, or meditation. Engaging in hobbies or spending time with loved ones can also help alleviate stress and reduce your risk of developing heart disease. 10. Consider supplements. While a balanced diet should provide all the necessary nutrients, certain supplements may be beneficial for heart health. Omega-3 fatty acids, for example, can help reduce triglycerides and inflammation, while vitamin D supplements may help regulate blood pressure. However, it is important to consult with your doctor before taking any supplements, as they may interact with medications or have other side effects. By following these tips, you can significantly reduce your risk of developing heart disease and live a longer, healthier life. Remember, it's never too late to make positive changes to your lifestyle and prioritize your heart health. Conclusion: as we come to the end of our discussion on heart disease, we hope we've provided you with valuable insights into this prevalent condition. It is crucial to be proactive about your health and take steps to reduce your risk of developing heart disease. Thank you for watching today's video. If you found it informative, please give it a thumbs up and share it with your friends and family. Don't forget to subscribe to our channel for more health-related videos. Stay healthy and take care.